Good afternoon, everyone. Thank you to the reporters joining us in person, and thank you to everyone who's tuning in. As usual, I'll start with a quick snapshot of the data for the day. As a reminder, we have an enormous amount of data posted online on the COVID-19 data page on the Rhode Island Department of Health website. We have 221 new cases to report. There are currently 269 patients hospitalized, and of those 269, 68 are in the intensive care unit and 48 are currently on a ventilator. As the governor has been saying, the stability and slight drops we have seen in these numbers are a good sign and a reflection of the community mitigation work that Rhode Islanders have done. Unfortunately, we have 18 additional COVID-19 associated fatalities to report. One of these people was in their 50s, one of these people was in their 60s, everyone else was in their 70s, 80s, and 90s. 6 who passed away were in their 70s, 6 who passed away were in their 80s, and sadly 4 who passed away were in their 90s. Our thoughts and prayers are with these families, and our thoughts and prayers are with all Rhode Islanders who are dealing with loss or who are trying to manage any kind of heightened anxiety at this time, all of which are understandable and challenging. That could be anxiety related to uncertainty about finances and employment, or it can be worried about the safety of loved ones. If you're able to, please take a moment today, and maybe even every day, to remember those who are dealing with extreme difficulty right now. We need to be able to support each other, even in our thoughts. So shifting gears, I want to recognize and thank Thundermist and Woonsocket for their work to get a testing site set up in the city. As I've said before, getting COVID-19 resources and support services into communities throughout the state, including our core cities, is absolutely critical. Thundermist is the organization in Woonsocket that convenes the health equity zones in that community. Our health equity zones, which the governor referenced yesterday, are areas throughout Rhode Island where residents and organizations are coming together to identify the health issues in their community that they believe need addressing, impacting their living conditions. They then work together in a targeted way, focusing on outcomes to address those issues to build health at the community level. That's economic health, that's physical health, and all of the elements that are connected to that. I often say that health does not start in the doctor's office. Health starts in the communities where we live and the schools we attend. Our health is determined by things like job opportunities we have access to, transportation we have access to, healthy foods like fresh fruits and vegetables that are readily available. We get asked regularly about why we see higher rates of COVID-19 in certain communities in Rhode Island. And as we have been saying, one immediate reason is because these are communities where many people live who are members of our frontline critical infrastructure workforce. We need to take immediate steps to support these people in the short term. Thus, the governor's announcement today to small businesses about being able to make sure that they have the personal protective equipment that's needed to support critical infrastructure workforce, like those who are out in a restaurant or going to certain manufacturing plants. One great example as well is the Workforce Stabilization Fund that the governor spoke about yesterday, which is getting bonuses to lower wage frontline workers. We also have a whole equity considerations team that's exploring other measures we can and need to take. We've also been trying to get at the underlying structural issues that make people more vulnerable to health issues to begin with. This is work that started long before COVID-19, and it's work that involves direct community engagement to sustain the improvements that we need going forward. We want to use the existing infrastructure that we have at the community level, like health equity zones and other community-based organizations, embedded with the people who are seeking to have their voice be lifted so that they can help people, family, and neighborhoods be able to bounce forward after this response. After a crisis like this, our aim isn't just to bounce back. We want to bounce forward so that everyone has an equal opportunity to be healthy and that we are in a better place on the other side of this. Lastly, before opening things up for questions, I want to remind businesses that they should be working on their COVID-19 control plans, and we want to help support all businesses to be able to do that. We want all businesses to be pulling together these plans on how they will be keeping employees and customers safe by doing what they can to prevent the spread of COVID-19. One clarification that I want to make is that all businesses need to have their COVID-19 control plans by next Monday, May 18th. And that includes businesses that have closed and are looking to reopen, and it also includes businesses that never closed and that remained open. We have a template on reopeningri.com. If you are a business owner who has not yet visited reopeningri.com, please do so today. As I said yesterday, Secretary Pryor and his team have been doing phenomenal work in providing for you whatever they can to answer your questions and to be in partnership with people throughout the state's COVID-19 response. If you have questions, you can either write to covidplan@reopeningri.com or call 401-521-HELP. We are here to help you so that all Rhode Islanders will know that it is safe and feel comfortable to start re-engaging in Rhode Island businesses.